Dr. Chamberlain Froese is an internationally respected leader in the field of maternal health. Many of you know all about her already. An obstetrician and director of the International Women's Health Program at McMaster University, she has dedicated her life to making pregnancy and childbirth safer in the developing world. Jean does this with a husband who shares her passion, and their 3 growing children. We'll get a current visual in just a moment. It's always a treat to connect with this companion of the Order of Canada. Jean, we are so proud of you.
Thank you.
We're just still busting that you would receive the Order of Canada at Rideau Hall this year from the Governor General. And you know, we weren't there. We didn't get to see all the delights. And now that I've heard some of them, I'm just going to ask you to share your husband's highlight of that evening.
Well, in the evening after they've given the order, we have a beautiful dinner with the Governor General and the other recipients and their partners with them. And afterwards, they just open it up that you can wander around Rideau Hall and look and talk with people, have something to drink. And so anyways, they also mentioned that there was a piano out in the other room, and it was donated by Glenn Gould. And there it was, and you were welcome to go and play it if you'd like to. So several of the people.
Piano?
It's a beautiful big grand piano, and several of the people who received the order, of course, were composers and musicians, so they played first. And when there was a quiet moment, I asked Steve Paikin, who's a friend of mine and also a supporter of Save the Mothers, to go and find Tom and bring him back, because my husband loves to wander and look, so he had disappeared. So Steve went and got him, and then I sat down at the piano and played a piece that I actually had composed for our wedding, and I had surprised Tom at our wedding. There was a keyboard off the side. He didn't even notice it, and I got up in my wedding gown, this is now 14 years ago, and played this piece. So I did that, and it was just kind of one of those Hollywood moments where all of these people in their black and whites, you know, VIP people, were just standing around and listening to this piece that I had played for my husband. So it was a beautiful, beautiful moment, beautiful memory.
Did we know you were a musician as well?
Well, I think I think it's just part of who I am, and I love just expressing myself through music. Yeah.
And your husband is a journalist, so none of this escapes the pen.
Exactly.
We're going to be talking with him too, and wonderful family. This is a family buy-in. You live in 2 places in the world every year for how many years?
Well, we've been living overseas. I've been living overseas for 15 years, in Yemen for 5, and then now in Uganda for 10. And Tom and I got married 14 years ago, so he's been with me that whole time. And we've gone back and forth 8 months basically in overseas, and whether it was Yemen first and now in Uganda. And then we're back here in the Hamilton area for 4 months of the year. So, and I work at McMaster University and St. Joseph's Hospital. So we kind of do both places, and you know, it's a wonderful experience for the children. Our children are global children, and it's interesting to see how it impacts their lives. Even Elizabeth, every Christmas, she raises money for the local orphanage, and we go and buy things, get things together. We go up and we give those things out to those children. And
back in Uganda.
In Uganda. And we, you know, it's not me telling Elizabeth, oh, it's that time of year again. She's already organizing what she's going to do at Christmas time when we go to see the orphans. And it was interesting this year, Moira, because she said very specifically, Mom, I'm running the program. In other words, she was going to run the program. She didn't want Mother interfering with my games.
At what age, Dr. G?
She's going to be 12 this week. So,
yeah. Well, let's look at a family picture. It's so nice to see the current crowd.
Yeah. Yes, yeah. So Elizabeth's just turning 12, and John will soon be 10, and Hannah, our Ugandan daughter, is 9.
Wonderful. And the dog?
The dog, Zach, is very much part of our member of our family. We also have 4 cats. They didn't make the picture this year, but
do they travel too?
No. We leave them in somebody's capable hands in Uganda for sure. Yeah, unfortunately.
Well, this has been a very special year on so many levels. Special for us, having our daughter enjoy the privilege of 8 months interning with you in Uganda. Pretty tough for her to come home. She just loved it. And I mean, that was her 5th time to Africa. But I think about our conversation at the airport, what a great and happy time that was. You came with the family. You weren't leaving yet, but you came to send your interns off, Catherine and Victoria. And we got talking about your life here. And what a fun family you are. I was hearing about a zip line in your backyard, just minutes from here. when you're home in Canada. Your neighbors are very aware when you guys are home, I think.
They are. John just built a new swing on our front lawn on the tree there the other day, and I thought there's probably going to be a few comments about that. But of course, when you live in Uganda, the kids have free reign. We live on a university campus, the Uganda Christian University. They have 85 acres where they can zoom around and do whatever they want. So when we're on a little bit of a stamp size property here, it's a little bit different for the children. But the children are children regardless, and they're happy where they are. And we love our life here. And people often ask us, where do the kids, what do they call home? And I would say they would call Africa more home, but I think we also try, and particularly Tom is gifted that, to make a home for a child wherever they are. And as I think about others that are maybe listening today, and you sometimes wish that your kids had more, I think it's really working with what you have and making it as full of experience as you possibly can for your children, and seeing the world through your children's eyes, I think is always so important. So regardless of whether we're in Africa or whether we're here or whoever we are, I think again just keeping that perspective of our children is so important, and just teaching them how does it reflect God's glory? How does it reflect who God is? And we've seen some very hard things in Africa. There's just been recently some significant disturbances there of terrorism and that sort of thing. And how do you help your kids walk through that experience? Not to be afraid, but to know that the Lord is with you, whatever happens to you. And when we were here, coming back to Canada, dealing with a very fast society, everybody's onto their, the kids come back, and Elizabeth's comment was, well, Mom, the I-6, or the I-5, I should say, it's outdated now, And so how do our kids then integrate into a society that's so technologically fast? And I have so many of my friends here struggling with that as well, too, with their children. But really, again, the principles of what do we want to instill in the lives and the hearts of our children. And technologies are wonderful, they're a tool, but it's not what we want to instill into their hearts. We want to instill into their hearts looking at the lives of others who do not have, of saying, how can we use our God-given gifts, generosity, whatever it is, to reach people who are needy in Christ's name.
When you were here for our missions telethon, focusing on Save the Mothers, I was so impressed with the responses of your children watching the broadcast back in the evening and challenging you and expressing their own desires to do something about what they're already giving their lives to.
Yeah, and you get just the opposite responses in your children. With my son, he says, Mom, what are you giving to Save the Mothers? And of course, I've given my life, maybe. Yes, but then there's Hannah, and she literally had tears in her eyes, and she said, Mom, I want to give $10 to save the life of one mother. And of course, she doesn't know what happened to her biological mother. And she just then started to bawl, and she said, Mommy, just don't let the mothers die. I want to give $1,000. I want to save 100 mothers. And I said, well, honey, you don't have $1,000, but you know what? You can pray that God will move people's hearts to give $1,000. There's people out there who can give $1,000. And so we literally, one morning, we prayed together that God would move and that God would encourage some people to give $1,000. And but I think, I'm in this work, and yet, you need to be reminded, even by somebody that is as close to you as my daughter is, about how important that work is. And it's touched her own life. She doesn't know what happened to her biological mother. And yet I said to her, Hannah, your mom knew it was best for you. She left you at a hospital because she knew that the people at the hospital would look after you. And God brought you into our family. But Moira, there's thousands of children in East Africa that don't have a mother. And when you live in East Africa and you don't have a mother, all of these things that I'm talking about, what is going to be brought into that child's life, it's going to be poverty, it's going to be crime, it's going to be just a very, very bleak future for those children. Because mothers in that context are the ones that really care for the children. They make sure they get to the clinic for immunizations, they make sure they get an education, they make sure they don't get married off when they're 13 years of age. So the impact of not having a mother is so huge. So, when I look at Hannah, she's a reminder every day in our family of the difference of a child who has a mother versus a child who doesn't.
And in Africa, community is everything.
It is.
And it happens around the women.
Yes, yeah.
I was surprised, and I have to say impressed, attending the gala fundraiser for Save the Mothers last November, early December. There were 200 people there. It was a spectacular evening. I hardly knew anyone. I recognized only a few faces. I thought, who are these people? Well, the good news is, and they came from both sides of the border, These are people who are invested. These are people who have come alongside, who understand the importance of just what you're talking about, the dignity and the rescuing of lives of mothers in the developing world. What's your vision? Big picture.
Well, my vision would be is that we really raise Indigenous leaders, people from these African countries who will be champions for change, that in that culture it becomes the norm that mothers should be safe, that mothers should have a dignified delivery, and that then they can do that wonderful job of raising their children. Because when we lose those mothers, there is no way we're going to see development in those countries. We're not going to see progress. And Moira, every time I come back from Africa, I'm always reminded there's this huge gap between our world here and the world there. And yet in 24 hours, you can be on a plane and be there. So it's not on another planet, it's on our planet. And we talk so much about conservation, about the environment. Part of the environment is these people. And do we really believe that there can be change? And I believe there can be, but it has to come from within, and we have to be really focused on helping them to help themselves and really doing that through leadership development. And that's really what Save the Mothers is doing, working with individuals who are leaders there and also working with individual hospitals and bringing change there.
You wanted to be a doctor from little. Did you ever imagine this scenario?
I thought I would be working in one hospital sort of in the middle of nowhere in a rural place in Africa. So I never really realized how important leadership development is and systems change. And what we take for granted in North America is part of the system. Like you hop out on the road's safe. Generally, you expect certain things. Well, when you go to many parts of East Africa and Western Africa and go into the healthcare system, there isn't a system there, or the system is not functioning as it should be. So the medication that, 33-cent vial of medicine that would save a mother from bleeding to death, it's just not there. And it's kind of like, well, it's just not there. And yet here we wouldn't tolerate that. So I think that part of it is what I did not anticipate I would see.
And that's what captured your heart.
And that's what needs to change, because one person is just one person. The system impacts the entire country, impacts the entire continent. And there's other places around the world, same issues as well too. We look at Haiti and some of these other countries as well too. It's systems. And so we need to help people in these countries to develop their systems. They can do it. It's not about us coming and doing it, but we do need to walk alongside of them and train them.
And what you've been doing for how many years at Uganda Christian University?
10 years.
10 years. That needs to go to other countries.
Amen. Yes, we're looking forward to that. That as God gives us the resources, as people get behind the vision. And Moira, I've just turned a very significant number in terms of my birthday, 50. Yes, well, but I realize your life is short.
Yeah,
and do with your life what you believe in. And I really believe that people here want to help, and I think this is one way that we can really help and really put our shoulders together with people around the world who need our help, and it makes a huge difference.
Thanks for all you do, bless you, and thanks for the challenge.
Thank you.